Okay, good morning, good afternoon, good evening. This is Dr. Garais, your professor for MED 120. This is week 1, chapter 2, medical terminology. And this is body structures. And what do we, this is a quick lecture, a quick overview. If you look at your objectives, structural units of the body, um, anatomical positions. Okay, you'll also see that again in anatomy, physiology, and your clinical classes. Body cavities or regions of the body, and terms related to position. Up is no longer up, it's superior. Down is no longer down, it's inferior. Left is left lateral, right is right lateral. Um, Things of that nature. Now, common diseases, conditions, and procedures related to body systems, not as much. And pronunciation and spelling and all that will be in your medical language laboratory exercises. Okay? So let's jump right in. So, looking at human being in general, there's different levels of things. And you have the cellular level, so a whole bunch of cells all glued together make tissues. A whole bunch of tissues make organs, and the organs are grouped together in systems, and the systems make an entire organism. So if you're looking on the term of pathology, patho, which is logi, which is study of, patho is disease. So if the cells are messed up, then the tissues are going to get messed up. If the tissues get messed up, the organs get messed up. If the organs get messed up, it'll mess up certain systems. Now, we also study the systems separately, but in reality, all the systems are related and interconnected. So let's say you have cancer and it's at the cellular level. It's going to affect tissues, then affect organs, then you'll have multi-systemic organ failure, and then what's going to happen to the human being? The human being will then die. Okay? So you have to look at the reason why medicine likes to attack things in its earlier stages when it's at a smaller level that we can handle. Because once it gets to the systemic level here, then we got problems. And it'll be very, very hard to manage. So let's look at some words. And when you look at the word elements, that that's a thing that you're actually studying. And if you look here, these are all the combining forms. So you have your root word and your combining vowel. So those are combining forms. So let's look at what the ones are important. Chondro is cartilage. Chondroma. Oma is a tumor. And if you remember my um, chapter 1 um, video lecture or lecture, tumor is just a lump or bump. So until you have a biopsy, right? Let's just jump right out. I'm gonna write down every time I talk about a word. I'm gonna write it down to make it a little bit easier for all of us. So oma is a lump or a bump, but then without this biopsy, I wish I could take away the capitalizations. Is what it is. Biopsy, bio, right? And biopsy. So what's actually going on is bio is life, and opsy, and if you see a y, process of viewing, like the kind of related to the word optical, pertaining to viewing, right? So your optics, right? Scope, that's another word for it. So when you do a biopsy, that's a definitive pathological test to see if you got cancer, to see if the oma or the lump or the bump is actually cancer. Now, remember we talked about cells? So cytology, study of cells. We can also measure cells. Histology, logi, study of tissues. Now, cytology and histology are part and parcel of the department of pathology. Patho, disease. Logi, we already know that suffix now. We saw it a couple of times. Study of, or department of. Nuclear, right? We're looking at the cells, or R, AR means pertaining to. Now, pertaining to AR, IC, AL, there's a whole bunch of them. And there's a list on my notes, which will be forthcoming. Nuclear, nucleus there also means like the nucleus, or the center part of the cell that houses DNA, right? But nuclear also means, like for nuclear medicine, anything that deals with like radiation. Let's now look at directions. Anterior, Eor, pertaining to. Now back to what I was stating about pertaining to. Pertaining to means it's an adjective. Okay? So you can't just say blue. Hey, have a seat on the blue. You have to say have a seat on the blue chair. So anterior means what? Front. Front of what? Anterior what? Anterior chest wall, anterior cranium, anterior what? Right? And that means front. And if you have anterior front, you also have posterior here, which is back. Another word for anterior and posterior back, another word for back is dorsal. Al, pertaining to your dorsum. Caudad, ad means towards. So if you have pain that's going towards your coccyx or your tail, and that's your backbone, that means it's the pain is heading down south, right? From your back to the lower part of your butt. That's caudad. But if it's heading towards superiorly, or going up towards your skull, then that's cephalad. And if it's here, no, it isn't. So let me write it down here. What's this word? And ad is the suffix meaning towards. So if the pain is cephalad, that means it's heading towards the patient's head. If it's caudad, it's heading towards the patient's tail or tailbone. Okay. Lateral means al, pertaining to the sides. Bilateral, remember we talked about prefixes? Let's look at that word. Bilateral. Al means pertaining to. Bi means to. Later means sides. So something that's bilateral, if my patient's having a bilateral headache, where's the pain? The pain is on both sides. Doesn't that look like a beautiful both A and B question? Medial or middle, that's easy. Superior. Oh, the other one was for front, or your belly side, is ventral. Now the suffixes, you can see here. We already went to logis, logi. Let's look at ad. We already looked at ad. So something, pain, or maybe a lesion or something that's moving towards the middle is mediad. Moving, again, review, moving to your head, cephalad, moving to your tail, caudad. Logist, study of, so histologist, it's a person who studies the tissues, most probably is a pathologist, right? And remember, pathology, those are doctors, those are MDs, and they're experts at patho disease. And all disease is normal, just all messed up. Cytology, we already talked about. Let's talk about lysis. Cytolysis. Cytolysis is when lysis breaks down, right? So what's breaking down? The cell, right? Now, what other words do we know that have lysis in it? Let's look at the word analysis. Ana means parts. Lysis means break down. So the analysis is the breakdown of parts. Hey, what are you also studying? Anatomy. Ana is parts, and tomi means the process of cutting. So if I'm having anatomy, I'm making a process of cutting. Okay? Now you could see how easily, when you know the program word format, like all the parts, and then you start picking up all the parts, you could see how a lot of the parts are repeating themselves. Okay? Now let's go back to here. I missed one. Distal and proximal. So distal and proximal means pertaining to the farthest point away from midline. So for example, if I stretch out my hands, my fingers are distal to my midline, but my shoulder is proximal. So think of the word proximity. Proximity means something that's near or close, and distal, something that's what? Far or distant. Okay? Now again, you can go through your textbook and go through, these are nice questions. The combining form for nucleus, nuclei, and then O, right? Because remember, combining form is your root plus your combining vowel, and then you ask yourself, hey, am I right? Show answer, or I click on this box, nuclei, reset. Something pertaining to poison would be poisonous, so I could click on it, or toxic, right? Toxic. So if something was hepatotoxic, let's look at that word. Hepat means liver. Toxic is ick, pertaining to poison. So if something was hepatotoxic, if a drug was potentially hepatotoxic, that means it's ick, pertaining to liver, and the connecting vowel is what? Poison. So poison, pertaining to poison in the liver. And remember, pertaining to means that word is an adjective. That means it has to be describing something. Let's look further down, and you can see a lot of these words you'll see on my notes. But it's nice, you go there and you kind of like Q&A yourself. Okay. Now, the body planes and anterior, superior, inferior, we already got that. But if we look at these body planes, let's see if there's a better one. When we're doing chest x-rays and things of that matter, direction is important and positioning is important. So you have PA view, that's posterior anterior, right? Posterior means what? The P, back. Anterior means front. So a PA view, or a posterior anterior view, is the beams of that chest x-ray are going from the back to the front. Now, if it was AP view, my patient would be turned around with the front facing the waves. And these waves are pertaining to nuclear, right? Because these are radiation, right? X-ray is radiation. So you could be performing this X-ray, also known in slang as a plate or a chest plate, in Department of Nuclear Medicine or Nuclear Diagnostics. CXR, chest X-ray. So anterior posterior is from the front to the back. Posterior anterior is from the back to the front, right? And that's AP and PA. Now lat means lateral, which is side. Okay. Now let's go back to, I skipped it. Let's go back to this. And here's a nice picture we can find online. And planes of the body. Let's have a nice picture. Here's a nice colorful one. Okay. So if you cut the body into a front and a back, or an anterior and posterior, that means you have this purple, you're cutting the person this way. Just imagine it's like one big, very sharp laser pane of glass. That's called your coronal or frontal plane. Now, if I have a transverse plane, that means I'm cutting, now the coronal frontal plane is cutting my patient from the front to the back. Transverse plane is cutting my patient from the top part to the bottom part. And sagittal or mid-sagittal is cutting my patient in half. So let's look at some examples of coronal plane first. Coronal plane view. And so let's look at some images. Here you go. So this is someone's skull. So coronal plane, that means I chop them from the front to the back. If you can see here. Sagittal or mid-sagittal, I cut them in half into a left and a right, which is here. Axial, or that's in a way transverse, right? Here's another way to look at it. Is like a superior and inferior, or a top part and a bottom part. Here's also another way to look at it as well. Okay, so these are the different kinds of views that you would get in diagnostic medicine. Okay, so as a review, coronal plane cuts the patient into a front and a back. The transverse plane cuts the patient from a superior and an inferior parts. And a mid-sagittal will cut the patient into a right lateral and a left lateral. And notice that this is the left side of your patient, this is the right side of your patient. Remember, when you're looking at your patient, you're looking at it from their perspective, not your perspective. It's a nice way to save you in your future anatomy and physiology classes. So if we look at here, this plane, that's your coronal. This plane, mid-sagittal. This plane that's cutting her in half, superior and inferior, that would be your transverse. Okay? Let's look at now at some motions. Now, knowing what's normal and abnormal is one of the things that we do on a physical examination, also known as your PE, right? Acronym for physical examination is knowing the different kinds of movements. So if we look at adduction, my patient is adding to midline. And I'm looking at the word abduction, my patient is removing her limbs away from midline. And this is how I remember it. If you have two things that sound alike, I memorize one like my life depended on it, and the other one simply the other one. I remember abduction really easy because what happens when you get abducted? You get taken away. So your arms and your leg get taken away from midline, and that's abduction. Why don't they have other movements? Let's go of other anatomical movements. Let's look at some other pictures here. Okay. Now, rotation, right, is when things rotate. And flexion. If you look at flexion, I want you to think of the angle gets what? Smaller. And in an extension, the angle here at your elbow gets longer. Because if you remember, this is like 180 degrees, this is 90 degrees, and then less than that is 90 degrees. This is extension. Now, supination and pronation. This is how I remember pronation. Putting your palm down on the table. That's pronation. And then supination is simply the exact opposite. Those of you who may have slipped and hurt your ankle when you're wearing your your lovely heels, you could have an inversion where your foot kind of slipped and went inside, or an eversion when your foot slipped on its way outside. Now, this is how I remember eversion. When you're everting or evading, it goes what? Away and outside. And inversion means what? Going inside your ankle. And dorsiflexion versus plantar flexion, the way I remember it seems silly, but where do plants go? You plant them into the ground. So when my patient points towards the ground, like if they were, I imagine them standing up, if they were lying down, most likely lying down, and if they have plantar flexion, what happens? Their toes will point towards the ground. And these are the other motions, elevation and depression, of course. And these are the things that, if you have a neurologic problem or a musculoskeletal problem, this is what the doctor would be asking you to do. Okay? Just want to... Now, here's some more words. Now, we're also going to talk about cavities in a moment, but your abdominal cavity is a big space or area, and your abdomen isn't your stomach. It's the whole entire area right underneath your 10th rib and right above your pelvis. Cephalo or cephalad, we already went over. Cervical means pertaining to your neck. Now, there's two kinds of necks. If you have the cervix, which is your normal neck, the neck that holds your head up, you also have like a neck or a narrowing in your uterus, and that's called your cervix uteri, and that's also the cervix. So, depending when someone talks about cervical, if they're talking about a pap smear, of course they're talking about your uterus or the female womb. And if we're talking about a cervical collar, that means my patient had some trauma to their head, and that's that collar that if any of you have ever been in an auto accident, they put that rigid collar on your neck so you won't move your neck, just in case you have any cervical damage. Cranium, of course, is skull, stomach, gaster. So there's a difference between stomach and abdomen. Your stomach is this bladder-like thing on your left upper quadrant, on the left side of your abdomen, but your abdomen is like the whole thing, and we're going to show you that momentarily. Ilio or iliac means your hip bone. Means structure of, so ilium is the structure of your hip bone. Your cranium is the structure of your skull, right? Cranial is pertaining to the skull. So cranial fracture is a type of fracture. Al is pertaining to, it's a descriptive, it's an adjective, right? But cranium is a noun, it's a thing. It is your actual skull. Lumbar is pertaining to your loins or your back. Where do you wear your loincloth? You strap it around your waist, and that's where your lumbar is, or your lower back. Inguinal, that's your bikini line. Al, pertaining to your groin area. Pelvis, pelvic, ick, pertaining to your pelvis, which is your hips. Now, pelvimetry or your pelvimeter, that could be ultrasound, or that actually could be your gloved hand of your obstetrician or your gynecologist if they're doing an internal examination of your vaginal introitus and your vaginal canal and your uterus. Those of you, I hope, if you are female, you have regular visits to your gynecologist, and they will perform an internal examination or an IE, and that could also include pelvimetry. Spine, Al, pertaining to your spinal cord or your back. Chest, thoracic. So your thoracic vertebrae are around the area of your chest. Ick, pertaining to your thoracic cavity. That's the cavity that holds your lungs and your heart. And because remember, one of our goals today is to learn what cavities, and we're going to see a nice little picture about that momentarily. Your umbilical or your umbilicus or your navel or your belly button. So if you have peri-umbilical pain, that is pain where? Al, pertaining to peri is an example of a prefix. Umbilic is the root. So peri-umbilical means pertaining to around the navel or around your belly button. And many times appendicitis starts off as peri-umbilical pain. Then it moves to that place in the right upper quadrant, also known as McBurney's point, and that's when you have the classic signs and symptoms of AP or appendicitis. Oh, they already did it here, but we already did this. So this is a nice picture to look at as well. Actually, on my written exams, if we were an on-the-ground class, I pretty much take this picture, A, B, C. It's easy. Do you think you could do the same and quiz yourself? Of course you can. Now, one of our goals today is cavities. Right? Now, the thoracic cavity we went over, that's your heart and your lungs. Here's your diaphragm, a thin muscle that helps you breathe. You have your abdominal cavity here and your pelvic cavity here. Those are your three ventral or anterior cavities. Now, the two really important cavities are your cranial, which houses your brain, and your spinal, which houses your spinal cord. Do you notice that whoever built you, whatever higher power you believe in, or if you believe the space aliens made you, and that's an inside joke. If ever you're in one of my classes, ask me about that. But your cranium and spinal cord, which are vital, I could poke holes in these anterior cavities all day. it'll take you a while to die, even in your chest, right? Your chest is covered by a lot of bone and a lot of muscle, but if anything happens to your brain and your spinal cord, which is part of your central nervous system, you'll be done. You will be dead or paralyzed immediately. So those are the cavities or the big spaces that house certain things. Okay, let's now go over this. I kept on using the word right upper quadrant, left upper quadrant, so on and so forth. Let us look at this. Uh-oh. What's going on here? What's going on? That's weird. We were looking at body structures. Well, looking at body structures, body cavities. Here you go. We go right to the quadrants. It's a really neat way to go find what you're looking for. So let's go back to this. Now we're looking at this. This is easy. And again, this is the right side of your patient. This is the left side of your patient. You're always looking at your patient with respect to their orientation, not yours. So the right upper quadrant is here. Left upper quadrant is here on your patient. Right lower quadrant, left lower quadrant. That's easy. RUQ, LUQ, RLQ. Now this one's a little bit more challenging. So let's magnify just a little. Now you can see is it 9 boxes that you have to memorize. Let's not look at things that way, because if you look at things that way, then it'll fall out of your head as quick as you could put it back into your head. So let's look at a systematic way we can memorize this. Now, we know our belly button's in the middle, our navel, and that's your umbilical cord, right? It's where you once were connected to mommy at one time. Well, that's in the middle, so that's your umbilical. Now, gaster means stomach. Your stomach's here somewhere, but what's laying on top of it is your epigastric. So epi means right on top. Your epithelial cells and your skin cells are what? The ones that are right on top. And hypo is what? If you have a hypodermic needle, it goes under. So your hypogastric area has to be underneath. So if you look at only this, I know where my umbilical is. Right above my whole abdominal cavity has got to be the epigastric. Right underneath the whole area, it's got to be my hypogastric. Okay? So everyone would get the middle part. Now, there's a right and left parts, but they're both the same. So I just memorize one side and just know that the other one is simply left or right, depending what side. So let's look at what hypochondriac means. Act pertaining to condor. Condor means ribs, right? So right underneath my ribs, hypo, right underneath my ribs, and that's why when we think about hypochondriac patients who are trying to fake pain so they can get meds or sympathy or who knows what, right? 9 times out of 10, it's meds. They're always holding this area like, oh, I'm in such pain, doc, right around here. And that's your hypochondriac area. Remember your loincloth, lumbar area, and your bikini line, inguinal. And if I know I got a right side, I have to have a left. So you're not really memorizing 9 things. You're memorizing one thing, the middle, and another thing, the sides. So in actuality, that's 2 things you're memorizing. And that strategy is called chunking. Okay? And if you look at my notes, which I will be posting a little bit after the time of this video, that's a better way to study. By association, repetition, and putting things together. Okay, here's some more examples of the stuff I was talking about. Let's see if I missed anything. Pelvic. Oh, let's look at some abbreviations. We already learned AP and PA. Anterior posterior, posterior anterior. PA is also a physician's assistant, 4-year degree. We don't have one of those here at Stratford, physician's assistant degree, but we'll look into it, of course. It could mean pulmonary artery, but 9 times out of 10, when we're talking about a chest plate or a CXR, which is chest X-ray. We're talking about either PA or AP view, or both. And LAT is short for lateral. It means it's the side view. LLQ, RUQ, RLQ, we already talked about. Computerized tomography. Let's look at that word. Tomography or tomography. Now, graphy is remember the Y, process of recording. Tomo means area. So what does a CT scan do, or computerized tomography do? Well, it takes multiple slices of like multiple pictures in slices of your wherever you want to look at, and the computer puts it all together to put all the slices together to give some sort of three-dimensional model, and it's pretty neat. So a CT scan is just a fancy way of doing multiple X-rays and then comparing and contrasting the different levels. Now, MRI uses magnetic resonance imaging. You'll learn in anatomy and physiology that your human beings are just one big battery of pluses and minuses, and the MRI uses that to our advantage. PET scan, positron emission tomography, we don't do it as much. Use it mostly in research for neurologic, neuro meaning brain, logi, study of. Ultrasound, we use a lot. Ultrasound, ultra means above sound. So it uses these frequencies above sound, and it projects into the body, and then when it bounces back, the machine takes it and makes a picture of it. And your SPECT, or single photon emission computerized tomography. Again, SPECTs, neurology uses them for research purposes. It's not a common test we use. Additional medical term, adhesions, nice to know. It's scar-like tissue, because every time we cut you open for surgery, it's going to cause scarring. Or if you have any trauma or burns, it's going to cause scarring. And sometimes the scarring gets out of hand and forms these adhesions and makes it very hard to do future surgery. Edema, the best way to put it, it's just swelling. Any extra accumulation of fluid in our cells, tissues, or cavities will cause edema. Look at someone who stands all day. If your grandma likes to stand all day, there's the reason why they wear pressure stockings. You can see their feet. By the end of the afternoon, their feet start to swell up. Inflammation or infection, we already talked about in the last lecture. Know what that is. Now, let's look at septicemia. Let's break down that word. That's a new word, and that's interesting. Septicemia. So, if something's septic, like a septic tank, it means pertaining to waste. And in our case, we're talking about the nitrogen, excess nitrogens in our body. That's why you have to urinate and defecate, because we have to get rid of those extra nitrogens. And hence the term nitrogenous waste in the form of ammonia. You'll learn all that in anatomy and physiology. But emia is the suffix that means blood condition. So septicemia, blood condition of waste, of these nitrogenous wastes backing up. And also, let's say, for example, I had a really bad infection. Now it got into my blood. Now where's the infection? The infection is now everywhere. So now you could see how dangerous septicemia is. Okay? Endoscopy, endo is the prefix that means within. Scopy, process of viewing. So instead of doing surgery, we do a lot of this endoscopy stuff nowadays. So we don't have to cut you wide open. We just drill a couple of holes in you that will be easier to patch up. We can do mini surgeries. You could see there's a biopsy device, and where we can take a bite. That's a common slang in medicine regarding biopsy. Call it a bite. Fluoroscopy, fluoro, or something that's fluorescence. Sometimes we use in radiology, logi, study of radio or radiation. Those are the people who do X-rays. also known as nuclear medicine, also known as nuclear diagnostics. They do fluoroscopy. Now, we can attach a chemical onto something that will attach to maybe like cancer or something like that, and then we could see it and via X-rays and other means, and it pops out. MRI we already talked about. Nuclear scan, again, more radiology stuff, more X-rays, right? That's a nuclear scan. We X-ray like your whole body, especially if you are high risk for osteoporosis. You'll get something called a DEXA scan, and that's an advanced nuclear scan. Here's the CT, and a lot of people have to be sedated and stuff because this thing gets really claustrophobic and it's kind of stressful. I had a couple of CTs back in the day, in the 80s, when these machines were closed, and oh, it was not comfortable. Anastomosis, nice to know. Cautery, if you cauterize something, we burn something. IND, short for incision and drainage. I like if I have like a little thing of pus where I have to drain, I have to first incise it or cut it, and then we have to drain it. Let's see, anything else? Anything else? No. But lastly, and you could see here at the end of every chapter, there's this lovely summary of what words and everything we talked about. And here's a nice little list of all the pertaining tos. Ac, al, iar, ari, us, eac, ic, eor. That means they're all what? Adjectives, right? Cardiac. What's a good al? Coronary. Oh, geez. Pelvic, anterior, posterior, cardiac, pulmonary. All of them are what? AR pertaining to. Now, if you look at the medical record, right now it's nice to know for right now. But come week 4, week 5, your discussions are going to change, and you're going to start doing. We're going to start be talking about the medical record, medical activities. Okay, and I'm going to also be talking about SOAP notes. Here's a lovely thing in the back where you can practice. This is nice, right? Practice and see, which one is which. You can answer it, and it'll tell you if you're right or wrong. But unfortunately, take screenshots because your book does not save it. Okay? All right, now that's chapter 2. I think we're good, and thank you. And please look at your announcements for any videos or what do you call those things? Zoom meetings. Thank you. Jeez. Okay. All right, and have a pleasant Memorial Day, and please get to doing the work that's due. Okay. Talk to you guys soon.